Good afternoon, everybody, and welcome to the latest in our series of ENO Center for Transportation webinars. ENO is an independent, nonpartisan, nonprofit think tank. We shape debate on critical multimodal transportation issues, as well as building innovative networks of transportation professionals. It's also ENO's 100th anniversary. Check it out at 100years.enotrans.org for discussion forums, Living Legacy podcast series, and other interactive elements as we reflect on our last 100 years and look forward to the next. My name is Paul Lewis. I'm the Vice President of Policy here at the ENO Center, and today we are discussing the lessons learned from the Mobility on Demand pilots in the Los Angeles and Puget Sound regions. LA Metro, King County Metro, and Sound Transit a few years ago won a grant from the FTA's MOD Sandbox program that enabled them to provide enhanced first mile, last mile service to select rail stations in both of those regions. ENO recently released 3 papers that comprehensively review the data and results of these pilots from when they started in 2019 to when they somewhat ended, or at least changed their models prior to the COVID pandemic. On this webinar, we're going to learn from researchers at UCLA, University of Oregon, and the University of Washington about how those services performed, whom did they serve, and where this service took place. The presentation is going to conclude with some key recommendations from these reports for other agencies considering mobility on demand pilots. So next slide, please. So of course, we have to ask, what is mobility on demand? The Federal Transit Administration defined it in their Mobility on Demand Sandbox program. And in this context, what we're really talking about is shared rides that are hailed in real time for an impending trip. It integrates data for locations, traffic conditions, destination, payment information, usually requested through a smartphone, but of course can be requested through web browser or call center for those unable to use the smartphone. And it's important to remember that mobility on demand is not necessarily a new concept, but recent technological advancements have helped to facilitate its deployment in a new way. And so that's kind of how we're thinking about mobility on demand in these contexts. Next slide. And so ENO has been tracking this program, the pilots in both LA and Seattle, for the past couple years now. This is our web page where we have a bunch of reports with information that are all available for free download, enotrans.org/eno-mod. The top 3 are the reports that we're going to be reviewing today that kind of cover the ins and outs of the pilots. But we also have some reports that looked at how they put together contracting, how they put together data sharing agreements, how they attempted to integrate fares and the challenges and successes they had in that arena, and then also provisions that they made for ensuring access to folks that have certain types of disabilities. And so these are all important concepts and parts of putting together a mod service, and so we encourage folks to check those out. Okay, and the next slide, please. All right, and so as I mentioned, today we're really going to get into the data, we're going to get into the details. We're going to hear from 2 presentations from 3 different presenters. Anne Brown and Michael Manville will be presenting. Michael is an associate professor of urban planning at the University of California, Los Angeles, and Anne Brown, who's going to be leading the presentation first, and with Michael available for questions afterwards, is an assistant professor at the University of Oregon. And then we have Mark Hallenbeck, who is the director of the Washington State Transportation Center at the University of Washington. He's going to be presenting the data and outcomes from the Puget Sound case study. And I will be moderating questions and the discussion that follows afterwards. So on that note, if you do have a question, you can enter it in the question box on the side of your screen at any time. We're going to get to as many of the questions during the Q&A session once the presentations are finished. While we don't expect any technological issues, if you're having trouble, we found that the thing that usually solves most of those minor issues is logging out of the webinar and logging back in. So if you're having a couple bumps or you're having a hard time hearing, try rejoining, and hopefully that takes care of your tech issues. And of course, Eno is happy to offer this webinar series free of charge. If you enjoy these webinars and are interested in supporting Eno's work, you can check out the link in the chat box and donate to become a member. You can find the slides and a recording of this webinar on Eno's website, enotrans.org. The recording will also be emailed to all registrants within a day as soon as it's ready. And so with that, I'm going to turn it over to Anne, who's going to join me here and then walk through the Los Angeles case. Anne? All right, take it away. Next slide, please.
Great. So as Paul said, I'm presenting the Mobility on Demand pilot for the LA region on behalf of my two colleagues, Mike Manville and Alexandra Weber of UCLA. And I'm going to present a little bit of context on the pilot specific to the LA region, and then spend most of the time on some of the high-level findings from this initial pilot evaluation. Next slide, please. Next slide. Some context. So the pilot in Los Angeles was operating primarily in 3 station areas. There were a number of selected metro stations within each station area. You can see on the map on the left, both the selected stations and then the geographic boundaries in which the mod services operated. So anyone who wanted to participate in the services could hail a free VIA, so this is the mod service that LA Metro contracted with, to or from any of those select stations, so long as their origin or destination, not at the station, was within the service area. Any of the trips that were hailed could be pooled with other travelers going to or from other destinations. They could be hailed via an app or a call center, and the services were operated weekdays from 6 a.m. to 8 p.m. Next slide. I want to talk a little bit about the overview of the pilot, which the whole course of the research for this first phase lasted about 13 months from January 2019 up through February 2020. Next slide. So before the pilot itself actually got started, the research team, along with LA Metro, surveyed current LA Metro riders at the pilot stations. And what we did was send LA Metro staff out into the field to ask and survey Metro riders about how do they currently get to the station. The goal here is to have some context about how people currently travel to and from the station and the demographic and socioeconomic characteristics of those travelers. We want to compare those then to the people who ultimately ended up using the pilot services. Next slide. So on January 28, 2019, the pilot began offering via trips to and from select LA Metro stations. Next slide. After several months of operation, the research team deployed follow-up surveys. These were surveys to people using the VIA services. They were online surveys asking things like, why are you using it? What is your trip purpose? And different characteristics of the traveler themselves. Next slide. And the pilot ended on February 26th. So the data I'm going to present in the remaining time is really from these first 13 months of this first year of the mod pilot phase. Next slide. I'm going to talk, the findings I'm going to present come from 3 different data sources that I basically just mentioned in the timeline. First, we have over 600 survey responses from LA Metro riders at the select pilot stations. Again, this is before the pilot began. There's trip data from about 100,000 via trip requests requested over the pilot time period, and then a survey of about 460 users of the mod program. Next slide, please. I'm going to break the findings discussion up into 2 sections. First, I'm going to talk about how riders used mod services, and then I'm going to talk about who used those services. Next slide. So the first thing I want to note is that use grew over time from the start in January 2019. So this graph shows the number of VIA trips, again, that's the mod service, each month across the 3 stations. And the only other piece to note here is you'll notice there were some slight adjustments and service changes to LA Metro itself that intersected with the mod services. Next slide. I want to present a few high-level summary statistics. Overall, nearly 80% of ride requests resulted in a completed trip. That's about 80,000 trips. Similarly, but slightly lower, about 3/4 of wheelchair accessible vehicle trips also resulted in a completed trip. Of those not completed, the primary reason was that riders themselves did not accept the trip offer. And when we investigated a bit more why, the trips that riders refused or didn't want to take had slightly longer estimated times of arrival than trips that were ultimately completed. In addition, the vast majority of trips, 99%, were made via the app, not via the call center, although it was available. Next slide. Riders wait on average about 9 minutes. An estimated time of arrival were actually quite close to the actual time of arrival. In other words, VIA was pretty accurate at estimating how long it would take for a ride to come pick someone up. On average, about 1.1 passengers rode in each VIA trip, and 40% of trips were shared between either people within the same party traveling together on a VIA trip, or pooled between passengers going to and from different destinations. And then on average, trips were about 2.3 miles, again, on average. Next slide. This map shows where rides were, and with a darker green indicating more trips. What I really want to spend this slide is talking about how one of our big questions was, do we see major changes over space, specifically as it relates to the characteristics of the residents in different neighborhoods? In other words, are we seeing more or fewer trips in neighborhoods with lower median household income, by racial or ethnic demographic and composition of neighborhoods? Are we seeing any evidence of either increased use of these modes by neighborhoods historically marginalized by transportation, or are we seeing potential exclusion by these services? And for the number of rides, we really found no evidence of that. The main factor in the number of rides in neighborhoods was actually the distance to transit stations. Next slide. And that held for the service quality itself as well. So we, in addition to the number of trips, we also looked at how long people had to wait for a ride. And again, the wait time really related to the distance from the trip, not the characteristics of people who lived in that neighborhood, but how far that neighborhood was from the pilot station. Next slide. Okay, so now who uses MOD and why? Next slide. So we're shifting away from where and how, and now into the who question. The main takeaway is that most people use MOD services quite infrequently. Just 13% of the users over the pilot period requested one or more trips per week. About 3/4 requested a trip one time a month or only once ever. So this is actually quite similar to what we see from broader ride hails, Uber and Lyft survey research, in that most people don't replace all of their trips with these services. They are using them occasionally. Next slide. I'm going to present now a series of graphs of charts about who use the MOD services. And what I want to highlight is there's going to be 3 columns for each of these tables. And the important part is not necessarily to look at the composition within, say, VIA users, but really compare across the 3 groups. So I'm going to be comparing the people who use the MOD services, which in these tables are the VIA users, compared to all station users. So these are the transit riders that we surveyed at the pilot stations, and then compared to Metro riders. And these are demographics of all Metro riders from Metro onboard surveys. So first, looking at race ethnicity, VIA users were disproportionately Asian, Asian American, Pacific Islander, and white compared to all station users and Metro riders. Next slide. Thinking about technology and transportation access, VIA users also disproportionately had smartphone and checking account access compared to all station and Metro users. Next slide. No major differences existed in terms of gender of the different users, but the VIA users skewed younger compared to either station or Metro riders overall. Next slide. And VIA users finally also were disproportionately higher income compared to the other 2 transit rider groups. Next slide. We also looked at how people previously got to and from stations before the pilot, and asked them, what would you have done, or how did you previously travel to the station? So first, I want to highlight that the plurality of riders who use MOD services said that before they use the bus to get to transit station, so about a third. So the plurality rode the bus, but next slide. When you compare that to all station users, the share of people who previously took the bus is actually quite low. So more than 60% of all station users took the bus to get to those pilot stations, compared to about a third of the people using VIA. People using VIA disproportionately previously, before the pilot were either dropped off or picked up, or took Uber or Lyft. So you'll see that, for example, about 16–17% of people took Uber and Lyft before the pilot, compared to about 3% of station users. And then about 6% did not use the station previously. There's some amount of new riders to these stations. Next slide. Trip purposes for VIA users were pretty uniform to all station users. The majority of people took trips for work, with the others, again, relatively consistent for school, errands, and recreation across both VIA and all station users. Next slide. Again, we were curious about where riders lived and where they were traveling to. So looking at where trips or where riders themselves were located, again, we found no evidence that riders were disproportionately represented or over or underrepresented in neighborhoods based on the neighborhood income or racial ethnic composition. Really, the main factor here was distance to stations. Next slide. So a few wrap-up points before I hand it off. The MOD pilot in LA successfully delivered about 80,000 trips in its first year. Most users did use MOD relatively infrequently, often typically less than once a month, but also nearly everyone less than once a week. In terms of equity findings, which was one of our key questions here, was, are these delivering services to those historically excluded from or marginalized by the transportation system, or are they inclusive or exclusive? We basically found no evidence either way. We did not find evidence that pilot was excluding neighborhoods or riders based on the characteristics of the neighborhoods in which they lived, but we also find evidence that the MOD may not have reached travelers with the fewest resources. We think about both income and also technology access. Next slide. With that, I thank you, and I'm going to turn the presentation over to Mark.
All right, thank you, Anne. Mark, we're going to go to the next slide here, and Mark's going to talk through the pilot in the Puget Sound.
So hi, I'm Mark Hallenbeck, and we might as well just jump to the next slide. That's all the people who did lots of the work in the Puget Sound region. Major partners, in addition to FTA and LA Metro, were King County Metro and Sound Transit, the transit agencies. A large amount of money was supplied by the city of Seattle, which really changed the services. And of course, VIA, who provided the service, and the University of Washington, who got to do the evaluation. So next slide. So the map on the right are our service areas. There are 5, all centered around Link Light rail stations. Now the 4 on the top and to the right were all in the city of Seattle, and they received a much larger time period when the service was provided, thanks to money from the city of Seattle. The Tukwila station on the very bottom only operated Monday through Friday during the peak periods, so a much shorter time frame, whereas the Seattle stations had VIA service throughout the time period where Link, the light rail system, operated. So this is a really important difference, and it showed up a lot in how our results came out. Next slide. We encouraged very much that people would pay for VIA with our electronic transaction fare card, ORCA. The interesting thing about ORCA is it has multiple fare categories. So there is a standard adult fare, which is for a bus $275. When you use Orca, you get the value of your previous payment goes towards your transfer onto Link, or if you've paid on Link, the value of your Link trip goes towards what you pay for a bus transfer. So this is a really important factor. The other thing that's really great about use of Orca is that there are other types of Orca cards. You can have a youth card, which are mostly how many students, particularly high school students, get to class. There is a low income category card, Orca Lift, where your fee is greatly reduced. And there's also a senior card and a disability card. Now, the great thing about having those card types is we get actual information on who the users are for everybody who uses Orca, which is really great. Next slide. So this gives us much more than just the information that comes from surveys. So when you look at it, our service was very similar to what you heard about in Los Angeles. In addition, however, to Orca fare card payments, you could pay with a Transit Go app. The problem with Transit Go was you didn't get a free transfer onto Link, but you did get a transfer from VIA to King County Metro's bus or vice versa. You could also pay with credit cards and debit cards. And of course, there were wheelchair vehicles accessible. So next slide, please. So as you heard from Anne, our basic project goals were very similar to what you saw in Los Angeles, a real goal of expanding access to transit, a testing of the partnerships with private companies that went relatively well. We were really interested in broadening the ability to use these new services, TNC services to the rest, and to a greater population, and of course, informing FTA on broad practices. On the right, you're going to see a map. We're going to come back to this map on multiple times. The geographic areas are census block groups, and they're colored for a variety of different ways. We'll talk about them in a minute. Next slide, please. Like Los Angeles, we had what I consider a very successful service. We carried over almost 250,000 passengers in the 10.5 months that our service operated. We operated from the middle of April 2019, essentially until the pandemic hit at the end of February, beginning of March, at which point the service was closed down temporarily. It's back operating again. The analysis, however, is for this 10.5 month time period. While everyone was told that they would share rides or they could be sharing rides, 90% of our trips were actually single person trips. Only about 7.7 were two people trips, and the remainder had more than that. There were times, however, during peak periods when rides were actually declined by VIA because we had no seats. So certainly late at night in the shoulder periods, they're much more likely to have a single person trip. In the peak periods is when you're likely to have multiple people in your vehicle. Good for us, and for many reasons, 96% of our trips were paid for with Orca. That was great for many perspectives. One of the best was we got lots of really interesting data as a result of it. So you'll see these things as we go. Next slide. Oh, one thing I should say about the previous slide, you don't have to go back. We had very disproportionate use of the system. Rainier Valley in the south actually had a much higher usage than the others, and we struggled to figure out why that is. So the graphic you're seeing right now is the geographic distribution. This is a number of trips by census block group. The darker the cell, the greater the usage. You see a tremendous amount of use down in the south. All of those people were headed to Rainier Beach. Notice the very bottom is relatively light yellow, Tukwila, which, remember, Tukwila has a much shorter service period. And then there's a bottom of the graphic right below the orange that not too many, it was actually in the Rainier Beach service area, but did not carry very many people. The other thing I'm going to point out is there's a white line that goes across in between Columbia City and Othello. There was a tremendous amount of utilization along that corridor, but it got split between multiple census block groups, so it doesn't show up as being black. The interesting side of that location is that the transit service goes north-south, which takes people in that area up to Mount Baker. And they didn't want to go to Mount Baker. They were much happier to go to their neighborhood service areas, which were Columbia City and Othello, but there wasn't good transit service that headed to those. And so they were quite happy to take VIA over there. Matter of fact, that group is very unhappy that there isn't a station in between Columbia City and Othello, and there will be in the next expansion of Lake, which is good. Next slide. So if you remember this graphic, this is where people were coming from, and this is where they actually save time. I pointed out that big yellow area down at the bottom, and we found when we did analysis of this that, as you heard for Los Angeles, time mattered a lot. As you got farther away from the station, more and more people used it until you reached a particular distance, at which point people stopped using it. And that is, it tends to be, it's too far away from the station, they take other modes of transportation. They don't go to Link to go to where they're interested in going. So distance was actually a multi-exponential function, which we found to be quite interesting. Next slide, please. So we were very interested in, did VIA actually bring new riders to the service? And the answer is yes. Again, we got to see from Orca how many people were using it. We saw a 26% increase between the winter and the summer in the number of people using Orca, using transit that also used VIA. So VIA did bring new riders to transit. It's possible that they were only new to Orca usage, but we believe it is actually bringing new people to transit. So we served that very well. Next slide. One of the things we could do, because we had these categories, is we looked at who was actually using the services. One of the and we could compare whether they were using it only once or whether they were using it many, many times. So what we saw was there was a relatively small number of people who used it very, very frequently. And there was a decent number of people who used it very infrequently, even over 10 months of utilization. One of the other things we found quite interesting was how heavily the youth market used the service. Almost 20% of all our trips of our users actually were youth, which was a fascinating outcome, and those youth tended to use it quite frequently. On the other hand, we had their senior population did not use it as much as we would have expected them to, given who was in the population. Next slide. This is our access mode. You saw this from Anne. One of the things we learned was that many people who walked to the station continue to walk to the station. From the surveys, we learned that people who would typically have walked would use VIA when they had lots of things to carry. They were headed to the airport, they had luggage with them, they had groceries with them, something along those lines. We did see many people coming from bus, but a relatively smaller percentage of people coming from bus, which was interesting. And we saw people, relatively low usage of Lyft and Uber to our transit stations, but people who did use Lyft and Uber were more likely to become VIA riders. So those from a utilization standpoint probably aren't surprising, but it is nice to see. It does tell us that there is some loss of transit ridership, conventional fixed route, to these services, but not very much. Okay, next slide. So we were very interested in disability use, particularly wheelchair riders. A very small percentage of our rides were done by wheelchair, 701 wheelchair rides out of, again, a little less than 300,000, so a very small fraction. We did, however, see that the disability riders, both wheelchair and others, were very heavy users of the call center, even though the call center itself was not used very much. So the call center actually served a very particular purpose for a very important group of riders, even if they were relatively a small percentage. Next slide. VIA has benefited ridership, which is interesting. When you look at this slide, the numbers are actually decreases. And as a university person, you always hate exogenous factors. One of our exogenous factors was our winter analysis period was in the middle of a giant construction project, which really drove down Link ridership. And yet, Rainier Beach, the group that had the station had the heaviest VIA usage, actually declined less in ridership than all other stations in the system, which meant people were still using the system much more because of VIA than they would have otherwise, which we found to be a very positive outcome. Next slide. We were interested in equity. What we found was that the service, from an equity perspective, much as you heard in Los Angeles, equity had a relatively minor to zero impact on whether people use the service or not. If you look in general, our VIA user ridership was slightly below what you would see on the bus service, but slightly above what you would see in link service. One of the big things we did notice, however, were that this huge population of youth riders, 20% of all ridership was from youth, and they used it a lot. One thing we did notice was that the youth ridership didn't respond to the surveys. They were like 3% of survey takers, but 20% of ridership. So it shows us some of the bias in our survey data. Next slide. I need to finish this up. I'm going over, sorry about that. From an ethnicity perspective, again, VIA riders, as you saw in LA, were heavily oriented towards white and higher income, and lower on the seniors. We did not see nearly as many seniors. Next slide. Customers liked, there's always a typo in these when you look at them later. Customers really liked VIA. That was an important thing. We certainly found that this service, while relatively heavily used, did complement and not replace fixed transit ridership. So fixed route ridership in the region, in that 5 areas, actually stayed quite steady, but the actual ridership to the link station did decline in minor amounts. Next slide. And again, I already talked about this. People who walked to the station tended to continue to walk. They were much less likely to switch to transit. But we did see that equity was important, and therefore choosing the locations where you put services, and these areas were specifically chosen to encourage a more equitable solution. What you saw was, yes, but not surprisingly, higher income people with better phone access use the system more than lower income people with less phone access. So yes, those equitable issues still exist, but if you choose and plan carefully on where you place these services, you can use them to continue to promote the equity of your transit services. And I think that is the end of my slides. Yep, and now we turn it back to everybody.
Well, and I'm just going to walk through some of the summary recommendations. Thanks, Mark, for that. And then we'll bring the panel on. We've already got a slew of questions coming in that I'm really excited to get to. And so, based on the analysis that Anne and Mark just walked through, put out our summary report, which has a bunch of this data summarized, and we have some kind of key takeaways for other agencies thinking about this service. And the first is that agencies can and should consider mobility on demand as a tool in the toolbox. Right? The pilots demonstrated that this service can function. Agencies were able to contract with a technology provider like VIA to make it happen. They were able to receive a tremendous amount of data and require that agency goals are incorporated into the service agreements. And the service pilots did attract new riders that facilitated mobility. And it was generally well liked, right? I think in Los Angeles, it was somewhere about the 10% of total riders took 66% of all the trips. So there's a bunch of super users in both regions that really, found the service tremendously useful. But we also think it's important to recognize the limits of mobility on demand service. It has certainly some compelling aspects, but it's hardly a solution that works in all scenarios. Both regions experienced increases in trip requests over the first few months, but ridership kind of leveled off over the last 6 months. While there were a bunch of super users, there was also a bunch of users that only used the service one time. Right, 40% of the riders in Los Angeles used it once, as did 21% in Puget Sound. And even with a free ride or a free transfer, the on-demand service only served a portion of station access, didn't average, more than 4 or so riders per driver per hour for the entire duration of the pilot, and generally cost more per trip than the average traditional bus service. And to be fair, the goal was not to increase or maximize ridership. there was a lot of goals that went into this, looking at how these services can be aligned, how these partnerships can be arranged, how these can ensure access for folks with disabilities or lower incomes, and demonstrate payment integration. We kind of summarize this at the beginning of all of our papers in terms of the project goals. But changes in the pilot parameters and continued community engagement might make some improvements in these areas, but the pilots did make some pretty concerted efforts to try to maximize the potential of the service. So within that, for those that are those agencies that want to do this, we certainly recommend following the best practices that we've laid out in our contracting, data sharing, fair integration, and accessibility papers. Again, all those are free for free download, and if an agency wants a briefing on any one of those, we are happy to do so. I think it's also important to be transparent about the mobility on demand outcomes. We were really excited that we were able to get the data that we were for this project and report it publicly, and we had a bunch of key performance indicators, and we were able to measure the service on how it hit those. And I think related to all of this, of course, is beyond just the papers that we put out. If you're going to go and do one of these, the best thing to do is to call up your counterparts at peer organizations and talk through their experiences, the pluses, the minuses, what they've learned, because there's a lot of people that have gone through this, not just at LA and King County Metro and Sound Transit, but other agencies across the country. And so there's a wealth of folks that have put out these kind of pilots before and can provide some really good lessons learned. So with that, I invite all the panelists back on, and those on the phone are listening to the live webinar. Please go ahead and submit your questions via the questions function on the sidebar. We have a lot of questions already, and so I'm going to try to consolidate those and work through those over the next 25 minutes or so before we reach the top of the hour. And so we've got, again, Michael Manville with UCLA, Ann Brown with University of Oregon, and Mark Hallenbeck with the University of Washington. Thank you all for joining. And so one of the questions that's come up a lot was the methodology for the surveys. In particular, how did we get this data? Can one of you, because I think they were pretty similar in both regions, can one of you kind of kick it off and just give us a better sense of how we were able to collect all this data about who was riding the service and how? Maybe Mike, you can kick that one off.
I don't care.
Sure. Yeah, thank you. So we had two different types of data, which I think both presentations alluded to that a little bit, but just to go into a little more detail, one was just administrative data from VIA itself, right? That the company is able to track how many people use it, how many requests it got that weren't filled, how many wheelchair requests it got, how long it took to arrive at a destination, and things like that. And that's the best data we have in sense of reliability, right? Because it's the full universe of actual trips. But of course, what we're really interested in many ways, and what that data don't show us, is who's actually in the vehicle, how those people would have traveled if they didn't use a VIA, how they travel in other ways, etc. And so for that, we had to rely on these two surveys. And the one pre-survey, and I'll speak primarily to what happened in Los Angeles, although I think what happened up north is pretty similar. LA Metro has a team that they usually deploy to take surveys, and they deployed that team before the pilot started at the initial station areas where we were going to survey, and just tried to get a sense of what the demographics of that station area were like before the pilot started, what the typical transit rider was doing, how they got to the station, etc. And then we tried to compare that with what we would call the VIA onboard survey, which is just that when someone did take a mod trip, they got a request to fill out a survey, and it wasn't a very long survey. And they could fill it out right there on their phone, or they could go home and fill it out. But it basically asked them questions that tried to mirror that pre-survey. You know, what were you going to the station for? How might you do this otherwise? And then the whole range of demographic questions as well about their income. And so the one thing to say, which I think, again, both of the presenters mentioned it, or at least alluded to it, was that, with a survey like this, you just get a lot less, you're not going to have a whole universe of responses, right? A lot of people just don't fill it out. And in the LA response, the big sort of regrettable thing for us was that the people who really did, the super users who really used it the most, didn't fill out the survey. And so we have, as Paul emphasized at the end of the two presentations, we have this situation where this service seemed most useful to a small minority of the users, and those users, for whatever reason, also wouldn't tell us who they were. And so that limits us. But that's, I'll stop there, but that's basically how we got these data.
And so the only thing I will add to that is, because the vast majority of our individuals used Orca, and Orca has these extra categories, we have this one other set of insight into who these people are, and we were able to, even though we don't know who they are, we have a hashed ID of their Orca card, we have a hashed ID of what their VIA rider ID is, but we were given a link to that. So we could look directly and say, this particular individual, here's their survey responses about who they are and what they're doing. And oh, look, they're using an Orca youth card. So this is one of the 5 youth that we got in it. But look at all these youth we see out there. So that gave us a great way to kind of ground truth what the survey is. But our surveys were indeed very similar to what Los Angeles did. So the survey data are 2 good sets of data. And then we had this extra insight into who the users are based on the type of Orca card they were using to pay for their trips. And for us, again, that's 96% of all trips, which is just wonderful insight.
Thanks for that. Related to the data, I'm going to kind of go on a couple questions on this. We have data on who was riding VIA. We have data on who was using the station. How does that compare to who lived in the zones? Did we have data on that, and is there any comparison that you can make there?
So that's actually one of the slides. You'll see a little of that in the slide. There are a couple of references to it. So yes, we went and pulled out census block group data to tell us who actually lives in the particular zones and areas, and actually mentioned their analysis of rider characteristics relative to the census demographics for them. So our comparison is in that area, and you'll see some of those comparison statistics. Again, we have more white people riding the system, riding VIA, than we have in the neighborhoods, and the number of white people who are actually using transit is, somewhere in between. So you'll see a little of that trend line.
Got it. And another question related to that is a couple of people were really interested in the fact that there was not great take up from the senior population. Any thoughts or insights as to why that might be?
I think it's technological, in that, I think of my mother, who's 94 and still alive and refuses to have a smartphone. She wants nothing to do with it. But I think there is an awful lot of that. I think you see it in the exact same factor is one of the reasons we have such a high youth population in our service. They're used to technology. They're easy. It's something they do second nature. They have no problem calling up and taking a ride or doing wherever. The older you get, the less likely that's built into your expectation. Maybe if we had more training, maybe if we had more outreach in order to bring that group of individuals in, I think you might see it. But we did a bunch of training, we did a bunch of outreach, but I suspect we did not get the senior population over their higher reluctance to do this.
Got it.
Yeah, one thing, if you don't mind, add to that is that, there are existing services, and they could be better for sure, that help senior citizens get to transit stations. And so if you are in the LA area, one of the senior citizens that takes a train trip regularly or something like that, prior to VIA being rolled out, you might have figured out your situation. And the VIA might get you there faster than one of these shuttles, but at the same time, you might not be in a huge hurry because you're a senior citizen that, has more time than the average person. So I think, there's a certain amount of the people who are going to take this up might have already had something in place that they figured worked well enough for them.
And I'll just conclude by saying, I think probably none of us were particularly surprised by those results, partly because of what we know from Uber and Lyft surveys. So these are really similar in terms of the age demographics of riders. And I think there are lessons we learned potentially from programs across the country that have partnered with Uber and Lyft, for example, or via in other cases to say provide paratransit services. So I think it'd be worth talking to them, or I know there's been webinars on that as well, about how they, or what some successful strategies for reaching out to the older populations.
It was a perfect pitch, and for a webinar that we're hosting next week about on-demand paratransit. So hopefully picking up some of those issues, and we can continue that conversation. That again, there's a couple more questions popping in on that subject, but I want to make sure there's some time for some others. I do think, so there is a bunch of questions about how was this service marketed and what were some of the strategies for community outreach. That I'll say to start, that was not a focus of our research, not for lack of interest, but really for lack of budget and scope. We looked at contracting and data sharing and fare integration and wheelchair access, as well as the demographic usage. I understand that there was some direct engagement with communities. There were signs in the stations, there was emails sent out, and there was a lot of a pretty concerted marketing effort. But I don't know the specifics of all of it, just because we didn't have time to go through all of it. I don't know if any of you have any more details to provide about the marketing and how the service was marketed. If not, that's okay. I just wanted to see because we did a bunch of questions on that subject.
I don't have a great deal of insight. As you said, I know they had tables, they had signs at the transit stations. That's great if you're already a transit user. It doesn't help to bring in new people, but they did go out into community groups. They did send out mailers, those kinds of things, but I don't have details on them.
Got it. Okay. So a question that's coming up a lot is, does this service, or did this service decrease congestion or increase congestion? Something that is, I think, a difficult thing to measure, but one specific questioner asked here about the % of the rides that were shared and the load factor in the vehicles. I'm not sure if we figured that out, or if that is a metric that actually can be figured out in the same way and on this service. But can you talk a little bit about load factors and shared and effects on congestion?
So the simple answer is no, we did not greatly affect congestion. I can say that with quite a high degree of confidence. And that's for two reasons. One, even though, hey, we carried almost 300,000 people. It's a huge win. But when you spread them across days, you spread them across hours, you spread them across everything, we're not removing enough vehicles from the system. When you look at 90% of our trips were one person, we wouldn't have removed that many vehicles anyway. If anything, we might have added a few vehicles. So the simple answer there is no, we did not change congestion. Did we attract some more people to transit? Yes. Is that a positive thing? Yes. The place we moved vehicles from off of big roads because they're now taking transit and put them on smaller roads, yeah, that probably has some positive impact because you can add VMT to neighborhood streets and not do much to congestion. So yeah, I would say it's a positive, but in marginal terms, the answer is 0.
Any other thoughts to add to that, Mike or Ann?
Yeah, I would just add that, it really wasn't the purpose of this program. It was the purpose of the program was to increase access to transit, and ideally for people who would have a hard time getting to a transit stop, which almost implies that what we were aiming for was folks who might have limited access to a car. And so by putting some of those folks in a car who might otherwise be walking or just not traveling, maybe you're adding a little bit of VMT. And Mark is correct that, and in the grand scheme of things, this was a rounding error. But it would be sort of I think it's what we would consider sort of high social value VMT, right? It's, if this program works and you have people who would otherwise not be getting out to opportunities that are really important to them, that's the kind of driving we want to have. I think as we all know, there's very limited, and I would say borderline zero capacity for transit in general to reduce road congestion. It's just not what it does. I mean, if we really want to take congestion seriously, we have to start pricing peak hour vehicle travel, and not worrying about whether the occasional shared ride or non-shared ride is sort of adding or subtracting a vehicle on the margin, especially in these big metropolitan areas with a lot of latent demand.
And you look at who are our walking trip people, where a bunch of them, at least in the survey, would normally walk, but this time they took via, and they said, because I have luggage, right? And so that one trip becomes a short car trip to Link, which takes you to the airport, as opposed to hiring Uber to drive you to the airport. And on the main freeway, that may or may not have had a congestion related, but it probably had a lot of congestion related impact on the airport driveways, which are awful, just like they are in Los Angeles. So that's how much of that is good or bad. As Mike was saying, those are some actually really good positive wins. So I think the via did have very positive outcomes, but in regional congestion, it's drowning air.
Got it. So there's been a couple questions that have come in also on labor and labor provisions within the contracts. I'm going to ask folks to take a look at our contracting paper. That should be available for downline contracting. Is an area where both the Puget Sound and LA regions addressed that directly within their contracts. There's also some information in the contracting paper about about community outreach and some of the marketing pieces, and so want to direct people that way. And then kind of some forward-looking questions. What happens now? Things have changed a little bit with COVID, of course, and I have to say too, both pilots did continue during COVID. There was a little bit of rearrangement there at the beginning, but in Los Angeles, they allowed point-to-point service rather than shared rides, and you didn't necessarily have to connect to the train station. They added some essential destinations outside of the zones, and they included some food delivery actually from food banks. And in the Puget Sound region, the pilot eliminated shared rides in the same way, reduced some of their service areas and some of the stations used, but they've added some new features to enhance some access components. So those pilots have continued in some fashion, right, during this, and I think the LA one is going to continue for a third year. But the question isn't so much about what's going to happen in these regions, but what advice would you have for transit agencies around the country that are considering this type of service, specifically in terms of service design, service area selection, those kind of things, in order to maximize some of the potential? Maybe we'll start with Mark, and then we'll go Ann and Mike.
I talk easily, so I was trying to give Mike and Ann a chance, but they can consider for a minute. I think the thing I would say is there's a lot of potential here, but it doesn't work everywhere. Look for places to provide your services where there's a reason why people should use the service. So you don't want to put it on a high frequency transit route that provides really good service to those transit stations anyway. If you look at where our services were most successful, the white line across the top, what it really hit was a great transit market that was really badly served by the existing transit services, right? They took you the long way to get to where you really wanted to go. And so that was a really good market. If you look at the south, you think, okay, in the end, we actually think it's elevation change. We think there are a whole bunch of hills in that area that are causing people to say, I don't want to have to hike this hill either to or from my house, and the transit line, I can only go a block and I'm going to catch the via, and that's just, hooray, I want to deal with that. So look carefully at what the service provision is in your area. I think there are places where this set of characteristics can be quite successful. but without cannibalizing your existing fixed route service or whatever. I think you have to look at your regions as a human, as a non-transportation professional. Think of yourself as a transit user and say, yeah, it makes sense. I would use this because my other services are not very good. And then I think you can be quite successful.
Yeah, I think the only thing I'd add to that, those are great points, and then I'd be interested in Anne's thoughts on this too, is just when you say you want to maximize the potential, I mean, I think the thing to remember is you could define success in this in a couple different ways. And I think one of the temptations we often get in any environment when we introduce a new service is we want to see that lots of people are using it. But I think one of the things we noticed in Los Angeles is that for understandable sort of budget reasons, they didn't offer this service overnight. And I think the reason for that is that there's a reasonable recognition that fewer people would use it. And so by offering it during the day, you got, at the end of the pilot, you got higher ridership numbers than you might have otherwise. But the fact is that overnight is when the people who did use it probably would have really needed it. Right, that's where you'd feel very uncomfortable walking to the bus. That's where the time between buses would be longest. That's where you might end up stepping off a train and realizing there really was no good way to get home. And so as a result, maybe you wouldn't take the train. And so when you think about what you want to maximize, I think there's going to be a tension between, do I want at the end of this pilot to be able to say, I gave 400,000 rides, or am I comfortable saying, I gave 100,000 rides, but those are people who really otherwise wouldn't have used my service. And I don't know that either one of those is necessarily the right answer, but there's a big difference between those.
And I'd add,
go ahead, Anne, please.
Okay, I think, to Mike's point about goals too, I think it's important to think about, and Mark mentioned this earlier about the, community outreach efforts. If the goal is, say, helping travelers who are currently using the station make an occasional trip home when maybe they missed their bus, one bus was late, they missed the connection to the other one. Advertising, for example, at the transit station works fine. But if the goal is really to get new riders onto transit, we have to be a lot more creative, I think, in community outreach. Could be talking to community-based groups, local organizers, activists, and talking, and also right before the pilot saying, well, what do you need? Right? Does the service work for you? What are the remaining barriers? I know in our data, the call center was available, which is great, right? That's going to be a key program design for those who don't have smartphones. But in the data analysis, we found only 1% of calls were made through the call center. So clearly there was a disconnect or not a great amount of interest in using that. And I think future pilots or cities could consider, how do you reach hard to reach populations, and also ones that are often left behind by various pilots like this.
That's great.
I want to pitch into something that Mike said, and this is anecdotal, but there is a person who works in my office who uses a wheelchair, and she, unfortunately for her, was in the Tukwila service area, and she couldn't use the service, and the reason was she got home too late for the service. So even though she was really unhappy that the Tukwila area was outside of the Seattle service area where they funded those extra hours. And so she could have used it in the morning, but then couldn't have gotten home at all. And therefore, in the end, she didn't use it at all. So sometimes those evening services or the midday services are actually vital in order to encourage people to use the service in the middle of the day, because they're worried about their ability to get home at night because they don't have as much control over their schedule. So sometimes that's a really good thing. Even as Mike said, it's a loss leader to the service, but it's really vital to the people you're working on, which goes back to what Anne was talking about, is what are your real goals for this project?
That's great. And I think, something that we've echoed in our paper and certainly found valuable is that these pilots set goals, and then we had the data to track those goals. And I think that's really important for any agency that's going down this route, is that you have an ability to get a tremendous amount of data. I'd say contract with a good research university that knows how to get the data that you're going to need, and not a little bit of a shameless plug there, but I think there's a lot of value add in connecting with some of a local university to figure out, you know, what are you actually trying to achieve, and then ultimately take a look at the financial resources, and, you know, is this the best way to achieve the goals that you're setting out given your agency's budget. And so, you know, it is the top of the hour, and I think we've had a really good discussion today. I know that there's a bunch of folks that still have some lingering questions. Please do send those my way. My email address is plewis@enotrans.org. You can find it on our website, and I'd be happy to direct that to any of the researchers here or to the folks at the transit agencies. Don't hesitate to reach out for more information. You know, this is what we do at Eno, and this is what the whole research team is all about. So thanks everyone for tuning in. Thank you, Mike, Ann, and Mark, for joining us for this hour, and we will be in touch with everybody very soon.
Thank you. Appreciate that. All the work you did, Paul. And it's been great to work with you, Mike and Ann.
Same. Thank you.